Good evening, Iligan. Good evening, world. I am George Hernandez of Adventist Medical Center, Iligan, Haven. I will briefly discuss about antiretroviral adherence counseling. By the way, what is antiretroviral adherence counseling? It is a pre-treatment education to help patients develop understanding of their treatment. This includes, number one, discuss the importance of antiretroviral compliance or adherence to patients and the consequences if such is missed. Explain the possible results if the treatment is skipped or the patient stops on taking the medication. Number two, provide psychological support to patients to adhere to treatment over a long period of time. As of now, there is no cure yet for HIV, but the ARV treatment will help prevent the virus from multiplying. Thus, this should be taken for a long time or until such time cure is discovered. Number three, provide emotional and strength coaching support. Recent studies in psychology have shown that IQ measures intelligence, EQ measures emotional, and then we have strength quotient, measures the person's resiliency, the person's ability to bounce back from life's adversaries, challenges, and problems. Is the patient emotionally ready to start the ARV treatment? Number four, discuss the ARV drug to the patient, including common side effects and its management, dosage, and timing. For example, in first-line ARV, LTE or the 3-in-1, one tablet contains 600 mg of efavirenz, 300 mg lamivudine, and 300 tenofovir, in which it should be taken one tablet once a day orally at an empty stomach, preferably at bedtime because of its side effects. And important health teachings like, for example, patients should be on a hypoallergenic diet for at least 2 weeks to monitor any allergic reactions. Common allergic reactions such as rashes, itchiness, sneezing or runny nose, itchy and watery eyes. If such reaction will occur, instruct immediately to refer to the treatment hub. And lastly, link them to care and support group, which will help them resolve psychosocial issues concerning living with HIV. One of them is mental toughness. It is the ability to resist and overcome doubts that prevents them from succeeding or excelling a task. By helping them to choose a career path after being diagnosed with HIV. Thriving in the workplace, meaning that there is still a place for them to work without being discriminated. Family disclosure, relationship with their SO or significant others. Having HIV is not the end of everything. People living with HIV can still have a lifetime partner or a family of their own. Lastly, self-esteem, helping the individual or patient regain their self-worth, making them realize that they are still loved and worthy despite on their condition. And for them, they can see that there is hope and new beginnings. As a home of hopes and new beginnings, Adventist Medical Center Iligan Haven is open from Monday to Thursday from 8 a.m. to 4 p.m. and every Fridays, 7 a.m. to 3 p.m. except on holidays. Our consultation is every Monday and Wednesday, 1:30 p.m. to 4 p.m. and Friday, 1 p.m. to 3 p.m. Please wear mask and face shield at all times and observe social distancing. What we offer: apart from world-class facilities and trained healthcare professionals of AMCI, Haven values privacy and confidentiality of each patient. HIV, HIV pre and post-counseling screening, sexually transmitted infection screening, antiretroviral adherence counseling, isoniazid preventive therapy, management and treatment of HIV and AIDS, and primary HIV care for PLHIV or people living with HIV. Where to get tested in Region 10? You can visit at Adventist Medical Center Iligan, Mercy Community Hospital, Dr. Uy Hospital Incorporated, City Health Office or Social Hygiene Clinic in Cagayan de Oro City, Iligan City, Hinuog City, Malaybalay City, Valencia City, and Osami City. Community of German Doctors in Cagayan de Oro City and Valencia City. In Northern Mindanao Medical Center, Treatment Hub, Camiguin General Hospital, and licensed stand-alone laboratories. Knowing your HIV status helps you make decisions to prevent getting or transmitting HIV. I am George Hernandez from Adventist Medical Center Iligan, Haven, inviting my fellow Iliganon on May 29, 2021, 7 p.m. Philippine time for the worldwide premiere for the first ever digital concert with Marian Osabel together with the League of Iligan City's Beauty Kings and Queens. Maayong gabi, Iligan!